Much, Fred. It's so lovely to be here. And first, I just want to compliment the presenters on their elegance and clarity and really their respective modesty on kind of distilling key messages from what I know is exceptionally challenging work. And I think that that is not said enough. So there's just a couple points that I think I want to, really echo and amplify about what's already been said. And the first is really how the presentations underscore the importance of anthropology in drawing attention to the styles of reasoning. And why I say that, and again, those are anthropologists, those will seem kind of old hat, is that the general sense of anthropology is that it's about revealing other people's culture and beliefs. And looking back on the Ebola outbreak from the purview of COVID, it's striking how anthropological insights were sought, primarily because the affected communities were seen to have some kind of esoteric traditions that anthropologists would have some purchase on revealing, and therefore their perspectives were important. And I think what's so powerful, this consortium and kind of connecting and going across pandemic preparedness, is to show not only the kind of sensitivity to kind of local worlds and meanings, but also the kind of universality of those logics, whether it has to do with entirely reasonable concerns over the speed of R&D, the safety of products, their provenance, concerns that were really widely shared across the globe. So I think that kind of point about shifting power in pandemics is also the work of showing that culture is not just the province of particular peoples, but is, a nexus of shared meanings, interests, and values that are dynamic and cross-culturally legible. So, I think that is an incredibly important point to underscore. And secondly, and this really comes through, I think, in some of the presentations, is that those kind of styles of reasoning are shaped by the politics of a given moment, right? Veena Das once described really helpfully epidemics as critical events, right? Highly volatile and polarizing moments where social and political orders are really upturned and identity is at stake. So, public health interventions, which are already so socially complex, become, under the best of circumstances, become in these critical events, just, they gain amplitude and they become incredibly fraught. So just to say, kind of underscore the importance that has already come up in discussion, and that's been really, made by these presenters as well, is that the exceptional moments, the kind of critical events, have to be tethered and embedded in the kind of everyday, right, in institutional mechanisms that deal with other kinds of public health, and building those links that allow you to kind of see the exceptional outbreak response is actually part of the trust that you build into local systems. And this group has produced a really nice paper on vaccine preparedness, which I would recommend to you all, which makes this case that beyond kind of readying populations to receive vaccines, that part of that work is upstreaming engagement with the whole range of R&D activities. Lawrence mentioned kind of research is part of the response, and that this has to be part of how we think about kind of the forms of trust and engagement so that people know why vaccines have been produced so quickly. So I think, again, that is a really important area of study and engagement that kind of power shifting from below should throw attention on. And finally, and this is my last point, Fred, I promise I won't go over, is to mention again the challenge and delicacy of this work. And this really struck home for me because I'm in a department of global health and social medicine whose logo is health is more than a medical matter. However, it was clear during COVID, the kinds of critical engagement that we're used to doing as social scientists, kind of unpicking epidemiological data, looking at the broader social implications of large-scale policy interventions, was really hard work to do in a moment where we had to, demonstrate solidarity, support the NHS. And I think a lot of us really lost our critical footing. We had no idea what to say or where we should sit. So, just to say that this is incredibly challenging work, doing anthropological engagement, and how you kind of build both the frameworks for empathy with the pandemic response and clarify the kind of rationalities concerned, while at the same time trying to save lives and support health systems, strengthening and delivery. And it's a truly precarious balance, but I do think it's one that this project and platform really is a masterclass on how you pursue and how you strike it, because it's not, just about shifting power in pandemics from below, but it's about doing that work continuously, between outbreaks and before, to allow the kind of critical social scientific work that allows you to, attenuate the kind of critical event as a source of massive disruption. Thank you.